1.
Internet of Things, Connected Inhalers, a better way to breathe. Hi, I'm Megan Rooney, and this project is in collaboration with Addison and Victoria. Today, we are going to share with you a fascinating new piece of medical technology that has been developed. But first, let's dive a little into the conditions that would require it. First and foremost, Internet of Things connected inhalers serve patients who are suffering from asthma. Asthma is a chronic inflammatory disorder that can cause wheezing, shortness of breath, cough, and other respiratory symptoms. Most commonly, asthma is treated with the use of an inhaler with a prescribed medication to help relax the muscles surrounding the airway. Asthma is the most common chronic condition among children, affecting over 6 million of them, who unfortunately often use their inhalers incorrectly. Secondly, another population that uses inhalers are individuals suffering from chronic obstructive pulmonary disorder. COPD affects over 16 million Americans. That's almost 5% of our entire population. COPD symptoms include wheezing, cough, shortness of breath, trouble taking deep breaths, and excess mucus production. COPD cannot be cured, but the symptoms can be managed through treatments including inhalers, steroids, and lung therapies.
So now let's break down our medical device. What is IoT? IoT is the abbreviation and commonly used term for Internet of Things. According to I. Lee and K. Lee, IoT, the abbreviation for Internet of Things, is a new technological paradigm that is the ability for devices, machines, and innovations to communicate with each other across the globe. So, how are we using IoT to make smarter, better inhalers? IoT connected inhalers are smart inhalers that use technology to detect improper use of the inhaler and then alert the patient when they are using incorrect techniques so they can adjust and receive their medication properly. IoT inhalers are also able to track medication intake as well as frequent usage in order to obtain data of the frequency of flare-ups and usage. IoT inhalers connect through a Bluetooth censored attachment, and the data can be accessed via mobile app and website. This data provides feedback to the patient to ensure better usage. But why do we need a smart inhaler? Why not just a standard inhaler? Shockingly, a study by Biswas, Hanania, and Saberwal found that between 70 to 90% of patients have been using their inhaler improperly. When this happens, only 20% of the prescribed medication is able to reach the lungs and relax those muscles. However, with the use of an IoT connected inhaler, such as the CapMedic inhaler pictured to the left, over 10,000 different air techniques are able to be detected. The CapMedic manufacturer states that the inhaler will detect these errors, alert the patient's device, and correct their technique so they can fix it and receive adequate treatment for their asthma, COPD, or other respiratory infection.
Besides the CapMedic, there are other IoT connected inhalers on the market. Because there are a variety of apps and software that offer similar smart technology inhalers, there is a need for more integration and collaboration between manufacturers. These smart inhalers need to offer data that is easy to organize, upload, and share between patients and healthcare providers. Without the ease of interoperability, as this image demonstrates, IoT connected inhalers will not likely fare well in the market. There are also financial and privacy implications to consider. In a 2021 article from the Journal of Thoracic Disease, Dee suggests that manufacturers incorporate the smart component within the inhalation device so that it is considered a part of the medication and therefore will qualify for insurance coverage. Additionally, users are concerned for their privacy since these apps will have access to their medical data. As a health information platform, these apps will need to implement privacy guidelines to ensure that they adhere to HIPAA protocol. Now for our discussion questions, we would like to know if at a certain point, should there be a point where the patient has corrected all of their error techniques and transitioned back to a regular inhaler to save money? Or should the error correction techniques in the smart inhaler continue to be used indefinitely? For a second question, We're asking, how do you predict different stakeholders will react if smart inhalers are introduced into the market? Can you think of certain challenges that may arise before smart inhalers can become fully integrated in clinical settings? And finally, since smart inhalers are a recent development, there are concerns regarding the cost, technology, and ease of use. With this in mind, do you believe that the benefits of smart inhalers outweigh the drawbacks? This slide displays the references used in our presentation. Thank you for taking the time to listen to us share some information about IoT connected inhalers. Similar technologies to these Bluetooth connected devices are at the forefront of medical innovation and will be highly influential in the progress of healthcare.